Okay. Hello, fellow hair loss sufferers, YouTube surfers, and online posters. Dr. Feller here in the office in the middle of a consultation, and I'm talking with Questionable Hairline Guy. That'll be his name online, and we're trying to figure out where to start his hairline. So I'm going to turn the camera over to him. He's got his face covered so that you can't see his identity, and I'll also try and keep it above. So he's got the mirror covering it, but I'll try and keep it a little high. Now I'm coming in on his hairline. Everybody can see. I'm going to just drop this right to your eyebrows just so everybody knows where. There you go. So we know where your face is. So I'm just going to walk around, and I already drew the line, as you all can see, of where I think the hairline should be. The Questionable Hairline Guy is not exactly sure if we should go even lower than that. Now, my recommendation is to stay, I'm going to bring this right in on the hairline, is to stay in the hairline, where his original hairline is. You can see it here. I'm sure when he was younger it was even lower, down to this point here, where he has some residual hair. But I'm thinking of filling in a band that starts right up in here, right down to the front here, that goes all the way in, gets a little deeper over here, fills here, and then deeper on this side here. I think you can all see that in the camera. Okay, now Questionable Hairline Guy, what questions did you have while I have the video camera on you that you were concerned about?
My forehead being exposed.
So you wanted to come down lower on the forehead?
Yes.
Okay, my thinking about that is that, number one, because the top here, you still have some pretty good hair up here on the top, but you're a young guy, you're 28 years old, and you've already have some considerable recession, especially in the corners over here. So I think it's a pretty safe bet that you're going to lose more hair on the top in the future. It may not be this year, it may not be 5 years from now, but chances are this is going to go. So my thinking is if we go too low, you'll be too front-loaded, which means you won't have enough hair to fill in the top as it goes, and when you do lose it, it'll just look like there's too much hair in the front, as if it's weighted too much to the front. Does that make sense?
Mm-hmm. Yes.
And then you were asking about bringing the hairline. Instead of me bringing it up like this, you wanted me to flatten it a little bit. And the reason I recommend not doing that is because if you flatten across here, it'll begin to look more unnatural. Most people have a hairline where the front part, the front point, is lower than the side point. Mm-hmm. If I make it too flat, it's going to look artificial. And you know what looks like that? Hair pieces. Mm-hmm. Bad hair pieces go straight across like that. So that's why I recommend going up. And by the way, that's what your hair is doing right now, naturally. The remnant hairs are still here. Right. So to me, it's like we should just fill in a band going right across here, maybe about an inch in the front, and then going up to almost 2 inches up in the corners here where the parts are. Just wrapping around. So I know the questions you have is, will it cause shock loss to this area here? You said you had gone to another doctor who, what did the other doctor say?
I'll lose hair, basically. I'll have death of hair.
So he told you that if he were to fill this area in, that you would have shock loss over here.
Yes.
Okay, I have never seen that in my 20 years of practice. I've never seen shock loss in an area outside of the area I was filling. These fine hairs here, you may lose, but you're definitely going to lose them in time anyway. Will the surgery hasten their loss? Possibly. But again, I've never had a patient, even with these hairs that are beginning to thin, I've never even seen those permanently shock out. So I have zero worry, but maybe I'm wrong. Maybe there's people out there online who have something to say about this. And so we invite you to join the thread and to put in your 2 cents about what we should or shouldn't do for this patient. As far as I'm concerned, Questionable Hair Guy should have a new hairline put across here and just packed as densely as I can, just across here. And I would be relatively conservative. I probably would not go higher than maybe, I don't know, maybe 1,500 grafts at the outside, most 1,800, somewhere in there, packed and tight along this front line. But if anybody out there has any comments they want to throw in here for a Questionable Hair Guy or from me, please do. As we're back. As Dr. Alan Feller, we're signing off. We look forward to your comments.